Welcome back in. It is the local and community issues and answers right here with Jonathan Lawson. We're so thankful to have in our studios today from the Kentucky Blood Center, Miss Peggy Aiken and Martha Osborne. Welcome in, ladies.
Thank you, Jonathan.
And we're going to be talking about donating blood. Tell me and the viewing audience, how important is it to donate blood?
It's very important to donate blood because there's no other way to receive that life-saving source except by having donors come out and donate it and have it readily available for those that need it. So it's very important.
Now, Peggy, how long have you been with the Kentucky Blood Center?
A little over 8 years now.
8 years. Now, I'm sure throughout the years you've seen countless lives changed, helped, and just people, the source there.
Exactly, and people don't realize when they come in to donate blood what an impact that's having on patients at our local hospitals and clinics. I mean, they are literally saving their lives. So,
Oh, that is so good. Now, Martha, how long have you been with the Kentucky Blood Center?
I've been with the Blood Center 26 years.
26 years. Now, what is your primary position there?
Well, I work with recruiting the donors and marketing and communicating the need for blood, and work with Peggy out in the field. We try to get as many donors into all of our blood drives. You know, we need about 400 donors to show up every single day in order to provide all of the blood that's used in the area that we serve in Kentucky. So it's a pretty big job.
Very well, very good. And Peggy, what is your position at the Kentucky Blood Center?
well, I'm actually the area representative for the Kentucky Blood Center. I schedule the blood drives in southeastern Kentucky, make sure we have enough drives set up so that people have plenty of opportunity to come in and donate blood for us.
Okay, now educate us a little bit. What does this blood go for? It goes for surgeries, or how does this work?
Well, the blood is used for, people that are in car accidents and lose blood, burn victims, people that are sick. Anytime you're in the hospital and you need blood, that blood was donated out in your community. So
Very good.
A lot of people don't realize just ongoing illnesses can require multiple units of blood. Cancer patients require quite a bit of blood very frequently. Radiation and chemotherapy can destroy platelets in the blood supply, so oftentimes they can require a large number of platelets.
How long can blood be stored?
That's a great question. When you donate a unit of whole blood, we separate it into its components so we can help more than one patient. The red cell part of that can be stored for 42 days. Now, of course, we rarely get to that. Most of the blood is transfused within the first 2 weeks. The platelets, that's what clots, what causes your blood to clot, and that's something that cancer patients use quite a bit of. They're only good for 5 days. So that's pretty tricky to manage that blood supply. And then plasma can be frozen and reserved for a year.
Oh, that is good knowledge right there. And Peggy, let me ask you this. The Kentucky Blood Center, what areas do you cover? All of Kentucky or what?
the Kentucky Blood Center, they actually service nearly the whole half of Kentucky.
Eastern half of the state.
Eastern half of Kentucky. And so this viewing area, Kentucky Blood Center services that area.
And Peggy has, how many counties do you work with?
I have Laurel, Knox, Leslie, Whitley, Clay, Perry, and Harlan counties, and Rockcastle counties that I service.
So the viewing audience today, you need to encourage the people to get in behind the Kentucky Blood Center, donate blood. Tell us the process of donating blood.
Well, you know, it's actually a pretty simple process. You come in and register into our computerized system. Then you're going to answer some health history questions. And they're pretty extensive. And then we review those questions with you, and we do a little mini physical, we like to call it. We check your blood pressure, your temperature, your pulse. We do a finger stick at that point. And actually, many people say that's the worst part of the thing. But we do a finger stick, and that's to check to make sure you have enough iron in your blood to share.
Right.
So if you pass all of those things, you can feel really good that you're healthy and you are in good shape to donate. Because when we're screening a donor, the most important things in our mind are, is that going to be a good, safe donation for the patient to receive, but also is it going to be safe for the donor to donate? So if you do pass our screening test, you're in really good shape, and then you're able to hop on the bed, and the needle stick in your arm is, a needle in your arm is 5 to 8 minutes. So it's really not a long time. If you can stand a hard pinch on your arm, that's about what it's going to feel like. And then once you're done, we ask you to stay with us and have some refreshments. And a lot of times there's lots of rewards available as well. We almost always have a T-shirt for folks. And this summer we have lots of things going on, including we're giving away a 2013 Toyota Prius.
Oh my goodness.
So every time you donate this summer, between now and September 13th, you become eligible to win that car.
That is so amazing, and not only you're saving lives, you're enjoying yourself and getting with people, and it's just wonderful.
It's
a good
rewarding.
feeling. Yeah.
It really is. When you show up to some of these community drives, it's like it's a fellowship because these people see each other pretty much every 56 days. So, and they're all doing something to help out their community. It's a wonderful community service act.